Hi, welcome to Stat Sisters. My name is Carrie, and I talk each week with my sister Erin about all things nursing, with the occasional Harry Potter thrown in. We talk about the nursing topics that you care about. We also chat about nurses in the news, and most importantly, answer your questions. Good morning, Erin. How are you doing?
Why does it have to be morning?
I don't know, because it just sounds nice. Good afternoon, good evening, and good night.
Good day.
Hello, Erin.
Fellow people, howdy.
What's up? What are you doing lately?
Got our garden planted today. High five. Whoosh, we busted that out in like an hour.
Yeah.
Considering all the prep work was done. So
yeah.
Credit to husband on that and children because that's the hard part. So kind of pumped. It's only like, a month to a month and a half late. But hey, it's in.
But
now we just water it.
We couldn't have done it earlier because there were still hard freezes going on.
I know, and I'm still worried it's going to happen. But it's in, and we're going to have beautiful, yummy produce.
It's going to be delicious. Erin's garden every year is like crazy huge.
It kind of is. It's kind of great. I love it. And we were just chatting about, Ryan and I were just chatting about trellising. So we're going to be trying. We've trellised a little in the past, so we're going to try a little more this year. Because apparently you get like a better yield and it uses your space. So it's been all about gardening and yard work and hoping it's not snowing again for the last couple weeks. Because, normal middle of May.
Yeah, you're always worried about snow.
I know. Usually we don't have to, but apparently we do this year. Anyway, I'm just pumped that it's finally done because it has been stressing me out. Because I'm like, we're going to be harvesting in October and it'll snow.
Hopefully the snow is a little bit lighter for my first winter in Boise.
I guess we'll find out.
Yeah, we'll see.
Anyway, what's up with you?
Well, I've been enjoying my first 3 weeks at work.
Whoop, whoop.
I really loved our nursing week mini pods. That was fun.
They were awesome and a total hit.
Yeah.
So, thanks, guys.
Thank you. And there's 2 more that had come out that I just couldn't fit into Nurses Week, and so we put them out earlier this week.
Lucky you.
So those were kind of little leftover ones, but they were 2 really good ones. So I hope you enjoyed those. If you haven't heard them, go check it out.
Yeah, and we're getting some funny comments and feedback. Everybody seems to enjoy them, so we're glad. Carrie worked really hard on those.
Thank you. But I'm getting ready to go fly back to Houston and visit my man.
Yeah.
And my teenagers and my dog.
And matriculate one of them.
Yes. Yes. And my bed, too. I'm so excited.
Hey, you've got a fantastic bed. You just have lots of children in it right now.
So that's going to be great. Seeing my son graduate. I have 2 kids graduating. One on Saturday and then one at the end of the summer. And super exciting.
It's just crazy.
Do you remember when you were graduating?
Yeah, because it was like 5 years ago. Which is insane because we're kind of almost the same age, and yet you have a son graduating. I don't know how that happened. Yeah, no, it's ridiculous how quick it seems to have gone by because it really doesn't seem like that distant of a memory. I mean, when you sit and think over the years, okay, yes, a lot has happened.
Yeah, it's been 20.
Oh my gosh, that was us. And I very vividly remember it.
I do too. I really do.
That was nutty.
That reminds me. I need to make a candy thing.
Lei?
Yeah.
Necklace?
Yeah. Oh.
She's doing this like circular motion.
Yeah, you can't see that, but I was totally making a sign.
Is that like a thing in Houston, or does you want to?
No, well, I had one. Do you remember mine?
No, I don't.
My friend made one for me.
Oh, that was nice. No, I really don't remember that at all. I'm like, I didn't have one. I was thinking if it was our parents, I was going to be like, what the heck?
Well, you know.
Carrie had better grades than you, Erin.
It's not really true, actually. Anyway, yeah, I need to do that. I almost forgot. Anyway, so that's going to be fun.
And speaking of graduation, there's a lot of people graduating. I just went to a nursing school graduation for Boise State University, and it brought back memories.
Aw. Now, did you go to the pinning ceremony or the graduation?
Well, yes, it was the pinning ceremony.
Oh, cool.
But I mean, that's the best part anyway.
Yeah, congrats, grads. That's so exciting. Like, and if you're still like one of those later schools in the last week of finals, hang in there. Keep breathing.
That's right.
Just sleep if you can.
Yes. And listen, we are going to be talking all about getting jobs.
Yes. Next step.
So the next few podcasts are going to be all about that. So hang tight.
It's going to be amazing.
Yes. So what is our first topic for today?
I apologize. I'm like all scratchy. I've got a very allergy-induced, throaty, deep voice today.
Ooh. Should take you out to karaoke.
I know people are like, oh, does she have a guest on? No, it's me. It's Erin.
Okay, so our first topic is for all those nurses that are graduating. Yay, yay, yay. Congratulations, you made it.
You did it. You didn't think you could, but you did it.
We're both fist bumping.
Fist bumping over here.
We totally need to get our video going.
I know.
Okay, so we're going to talk about, first topic is NCLEX tips. This is one of the things that nursing students always ask me because everyone's scared. They've made it through the HESI or whatever things that they're doing now. I don't know all the names of them.
I know.
I don't think I took those. I don't know.
I did something. I think I did the HESI.
I don't know. We did something too. But
whatever.
The NCLEX is scary.
It's the next thing to freak out about.
Yeah.
Yes, you graduated. Now you may never actually be a nurse.
Yeah.
No worries. It's all good. It has nothing to actually do with your nursing knowledge, so don't stress it. That's how I felt. I was like, what the crap is this?
I know.
Okay, maybe a little bit.
So I may have shared this before. I had a baby. Let's see. I had a baby the week before we graduated, and then I moved 3 weeks after I graduated across the country with 3 kids and a dog. And I stopped. I made a pit stop on my journey to my new home, 2,000 miles away, and took the NCLEX.
No way. How did I not know that? That's really
I stopped at my mother-in-law's town,
That's
and I had
ridiculous.
scheduled it in Reading.
Oh my gosh.
And I took the NCLEX. I passed in 75 questions.
Well,
I'm proud of that.
Well, I would be proud of it. I did too, but I didn't have that fantastic. I was pregnant during mine. I was still bun in the oven for a few more months. And I remember checking into the testing center, and I'm obviously baby bumping. And bless her heart, the little lady's like, now, once you're seated, you have to stay. You can't just get up and move around. You have to stay through the end of the exam. Unless you need a break, then, I don't know, push a button or raise your hand or whatever it was.
Right.
And then she's like, because you might need to use the bathroom. And I'm like, oh no, my butt's not leaving this chair until I'm done. I said, I don't care. I said, once I get up, it's because I'm walking out the door. I was like, I will hold my bladder. 7 months pregnant, I don't care.
That's an accomplishment.
But I did. I passed in 75 questions. And it wasn't, I had been looking at the number, because of course you stress out, because they pound that in your head. And you're either going to fail flat on your face, or that means you passed. And so I'd been watching the number up through the late 50s, and then somehow I just got distracted, and so I wasn't ready. And then all of a sudden my screen just went blank, and I panicked. I was like, ah! And I thought, then my immediate thought was oh, was that bad? They just cut me off. I failed. I left there 100% convinced I was not going to be a nurse, because I was also determined I would never take that test again. So,
oh, geez.
Obviously, I passed and all is well, but I might have been a little hormonal at the time.
I was post-pregnancy hormonal and moving hormonal, but
that's crazy.
I was sure I had passed because I just knew I wasn't that dumb
I was
to
pretty
have
sure I
bombed
could have
it that bad.
I'm glad you had way more confidence in
I
yourself.
I totally knew. But we keep talking about 75 questions, but it doesn't matter. I've had some of my friends went through all the questions possible and still passed.
Yeah, it doesn't matter. And everything in between.
Mm-hmm.
And to me, honestly, I don't see it as a marker of anybody's aptitude as a nurse. Nope. I've known people who have failed it multiple times, not just once, not just twice, but are phenomenal nurses. They're just not great test takers.
Yeah, I'm like a super good test taker, but it doesn't really mean that I'm not smart. You just
know how to take, and
I know how to take
I mean, and they
tests.
talk to you about that. Well, hopefully, your professors have been talking to you about your test taking skills and giving you exams with similar test formatting, because it makes a huge difference. Because what they say is true. You know, there's sometimes multiple correct answers, and it's about prioritizing and understanding what they're actually asking in the question. And so, if you have the clinical knowledge but you don't realize how they're testing, you can be totally screwed. So it doesn't always equate to an accurate.
It's not an assessment of competence.
Yeah.
It's an assessment of minimal competence. Like you basically understand enough that they feel confident in letting you loose on patients.
And to start actually training to become a nurse.
Yeah. Yeah.
I mean, and that's one thing a professor told me one time, and I was kind of like, huh? But it makes sense. Like, she's like, when you graduate, no offense, but you're not really a nurse. You are just now at the point where you are licensed to start learning to become a nurse. Really. Yes, school has just been prep work for you up to that point. They just happened to call you a nurse. It was terrifying. I'm like, I don't know what I'm doing yet.
It's like when you learn how to drive. This is forefront of my mind since I have two teenagers. One is licensed, one is trying to get licensed. And I told them over and over, you are terrible at driving. No matter how good you think you are, you're terrible. And they're like, yeah, we know.
You're such a builder.
I know. I want them to know. It's important that they know that they're scary. They could kill somebody.
Yeah. That humility, I think.
Yeah. And but of course I was nice. I taught them how to drive, but
good luck with that.
But yeah, I want them to know, like, this is serious and you could really hurt yourself or somebody else.
Yeah,
and that's the same thing when you're a new nurse.
Yeah. Overconfidence is a bad thing. So
what are some of our tips for the NCLEX though?
Okay. So NCLEX tips, I would say, all the normal stuff that, like, I remember every year when we would do like state testing in elementary school, the teachers would be like, okay, make sure you get a good night's sleep tonight and you have a good breakfast in the morning, maybe have some eggs and all that. I totally agree. Try to get rested. I know you're going to be totally stressor. Maybe you're a stress eater. Maybe you're a stress anorexic. Maybe you're a stress sleeper. Maybe you're a stress insomniac. But do whatever you can do to get a good night's sleep. You know, don't be cramming up into the last minute.
No.
You're not going to get anything out of it other than an ulcer.
I wouldn't study like the day or two before.
No.
Like if you don't know it, then you won't know it. Yeah.
Yeah. So stop looking at rhythm strips. Stop looking at your pharmacology textbook and flashcards that you've been building up for the last couple of years. But just try to be rested. Not just the day of, but, eat a good meal the night before. Make sure you take the time to eat a good meal the morning of. You don't want to go in with an empty stomach. You don't want to go in low on protein or whatever and getting like blood sugar drops, and hydrate yourself. And like, seriously, you'll just feel better and your mental clarity will be so much better, because the last thing you need to be worrying about is your stomach growling. Or if you're pregnant like me, you getting queasy or hypoglycemic and needing a snack, and they think you're cheating because you're reaching in for a granola bar. So take care of yourself physically. That's my number one rule. Because at this point, if you've been in nursing school for 2 to 3 years, whatever your program is, if you cannot cram, if you did not learn it, you cannot cram that much information into, I don't care if you wait 2 months to take your NCLEX. It's not going to happen.
Right.
You can review, but you got to just hit the high points and not overstress. I really don't think, other than looking at rhythm strips, because I was terrified I was going to have to identify rhythms on an EKG. And I'm like, I can't remember which one's which. So, but really, I don't think it probably helped at all. I think it just helped soothe my anxiety, and that's fine. But yeah, so my number one advice would be take care of yourself physically, so you're at the best, you're at your peak mentally going into the exam.
Yes, and don't delay.
No,
don't delay. Take this. That's why I did the pit stop.
Mm-hmm.
You can't take it like the week after nursing school. You have to Yeah,
ours was like a 2-week minimum for everything to get processed.
Yeah, the paperwork takes a while and everything. So as soon as I could take it, I took it, and yeah, I'm glad I did. Instead of waiting, some people wait, and it's not good because that you get further from your training and it's harder to remember.
Mm-hmm. And your failure, statistically, the failure rate exponentially goes up for each month you put it off. So I would say definitely take it with my personal recommendation would be within a month of your graduation time. Give yourself a few weeks while the paperwork is being processed to go ahead and review some areas you might feel a little low in. A lot of people are all about taking like NCLEX review courses or even doing just an at-home NCLEX review and quiz. If that's your thing, great. If not, you probably know where your weak points were. If pharmacology is not your thing, go for it. But again, it's like the SAT. It's totally random. You don't know what you're going to get, the mix. They say, for instance, pharmacology is not my thing. I do great at it now, but I'm a hands-on application person. So I had to really start working with those meds to learn them and know them. And so at that point, rote memorization was hard for me. And I think it says like up to 19% of the questions could be pharmacology. And that stressed me out. I had two. I ended up having 2 questions in my whole exam that were pharmacology related. So you just don't know. You could be doing med calculations. You could not. Who knows?
I was worried about the meds, and all I did was memorize the categories.
Right.
I didn't memorize any of the actual names because it's just too much.
Oh, there's so much. There's thousands. Really, that you cram in one little semester there. So anyway, yeah, I would say definitely, in my opinion, take it within a month. That gives you plenty of time to do some review without stressing yourself out, to kind of pace it. And then, own it. If you've been getting decent grades throughout nursing school and you haven't been failing, I know all of us nurses feel like we're failures, and if we're not getting, setting the curve, we're not doing good enough, but you're gonna be okay. Just chill. You're gonna be your own worst enemy.
That's right. And another tip that I use whenever I am studying for like this kind of board exam, I take practice questions. Mm-hmm. Like I do those practice tests, and then the ones that I get right, I'm like, okay. And then I don't ever look at those topics again. I only focus on the ones I didn't get correct.
Right.
And then I review those topics, and then I just take the test.
Yeah, and just narrow it down that way. So,
yeah.
Because it does, at the beginning, you're like, oh my gosh, where do I even start? And so I think that's a good method. If you don't know, like, hey, I'm really strong here, but I'm really stinky here, that's a good method. Take that just scattered, because it's kind of a shotgun on topics, and you're like, okay, I aced all of those. I'm not even going to worry about those. And it really helps narrow you down and funnel it into with something that seems a little more manageable.
And then get it and have a strategy. If you don't know and you can't narrow it down, pick C. Always. And then if
I'm not going to back that.
Statistically, it's true.
Yeah.
It's C more often. It doesn't matter if you don't know any of the answers, and you could pick A or B or C or whatever. But if you always answer the same one, then you're going to get more right than just to randomly guess.
So is this like along the theory of if you get lost, stay where you are?
Sort of. Hey, I've passed all these tests.
Okay, then listen to her, people.
And then also, and you can back me up on this one. If you don't know the answer and it seems really complicated, the answer's ask your charge nurse. That's the answer.
Never go to your doctor. That's not ever what it is, because they want you to be thinking and using your nursing processes. But yeah, refer to a charge nurse. Yeah, that's always a good one.
Or like notify the provider is it's a question.
Notify the provider is sometimes an answer, but they want you doing all of your nursing interventions first.
Yep.
Not like, I don't know what to do, and you run in panic to your dog.
Yep.
You need to have done your vitals, your interventions, your PRNs, or whatever it happens to be, prioritize.
Yeah.
And yeah, if then if you have an issue, you better notify your provider, but that should almost never be your first step.
Yeah,
because even if you walk in and your patient is coding or bleeding out, you're simultaneously doing all those other fact-finding interventions, gathering tools, and when you're pulling that code button or whatever it is. You just don't think about that. You think like, well, first thing I'm doing is I'm getting my team. Well, you are, but you're looking at the patient, you're assessing the situation, you're starting getting vitals, you're positioning them, So it's very rarely go to your doctor first.
Yep.
It's interventions And definitely, your CABs or your ABCs or whatever we're teaching nowadays. Like I feel like every year we're switching that.
Yeah, I think it's every 4.
I know,
It's every 4.
Just enough to screw you up.
Yeah.
And charge nurse. That's always a good one.
Yes, that is. I found that was the answer quite often.
Yeah,
but
it's good to know when you're over your head.
Yeah, and I think that's something
recognizing
they
your
want to
limitation.
exactly. They want to pound that into your new nurse brain, like you don't know everything, so ask.
Mm-hmm.
I think that's a good thing.
Yeah. So yeah, assess. Vitals go with assessing. Interventions, CAB, charge nurse, kind of look at if it all seems super confusing, that they're trying to just throw you off. Step back, simplify it, go for the basics. That's probably what they're looking for is can you prioritize an extremely confusing looking situation? And it might be really confusing situation, but the same prioritization skills apply to everything, whether it's a simple thing or a friggin' hot mess.
Yep, that's true. My last tip is I always, if at all possible, I will drive to the site unless I know exactly where it is. I will drive to the site and see like how long it takes me and like where I'm supposed to park, because for me that is a thing that makes me very anxious.
Mm-hmm.
If I'm late, or if I'm like I can't park and I can't find where to go, or I don't know what door to go in, and so that would set me up to be anxious going in, and then I leave like super early. Like so I just will sit there in the parking lot and meditate or eat my breakfast or whatever, just so that I know that I'm there.
So like a dry run.
Yeah.
Have you ever robbed a bank? Because that's kind of what they do. They like clock it. I'm like, podcast deepens.
I'm not going to answer that question.
All right. So, and lastly, when you are done, don't do what I did. Don't walk out of there and be like Debbie Downer for 48 hours until you can check your test results, or 24 or whatever it is now. Celebrate it. You did it. Whether you passed or not, you did it. And that is a huge accomplishment. It is a very stressful exam. Give yourself the benefit of the doubt. Pat yourself on the back. Get an ice cream cone. Whatever. And then when you find out, you find out. But positive thinking is huge. Don't be down on yourself.
Do you suggest that they pay the extra $12 or whatever it is to
I did, because I was so anxious about it. And so that's the kind of person I am. And so if it helps you chill, then great, go right ahead. If not, if you are a little totally calm person who can just ride it out and wait, fine. But I also had a job that was dependent on my passing, and my start date was waiting on that. So I was a little worried about that.
Well, I
just relocated for that whole job, so across the state.
Just a little pressure.
Yeah, no pressure at all. Don't worry, Erin. If you don't pass, we won't keep giving you paychecks. Because I'd been hired on like a probationary state until I passed, and so I was like, oh, geez.
Well, I think it's totally worth it. You've already spent thousands of dollars. What's like 15 or whatever?
It was like, I want to say like under 20.
Yeah,
it was
like,
nominal.
Who cares?
It's
a total racket, but I don't care.
I know. I was like, sign me up. Because it did. It helped me like either way. That way I didn't have to stretch. Because what is it for? Otherwise, it is like 2 weeks or something ridiculous like that. Mm-hmm. Come on, people.
Yeah.
I can watch my pizza guy make my order like live on my tracker. All right. So any other tips? Are we good? I'm sure you guys are going to ace it. You're going to do great. Take care of yourself. Mentally, physically. Own it. You're going to do fine.
Yes. Good luck. You don't need it. You got this. And the worst possible thing that could happen is that you fail it. And then you regroup and you take it again and you pass. So whatever. It's fine.
Don't give up. Keep it up. You'll get there. And it's no measure of what kind of a nurse you are.
Yeah. You're going to rock it. Okay. So whether you are a new nurse or you are just wanting to change jobs, it's a good time to do it.
Yeah. The market is fresh and flourishing.
So our next topic is, how do you find a super sweet nursing gig?
Carrie, where can I find a super sweet nursing gig?
Well, Erin.
Since you asked.
So I'm going to back it up. the way you find a super sweet nursing gig is to know what you want in a
Yeah.
nursing position.
But what about the people who are out there like, I don't know?
Well, then we're going to tell them.
Oh, good. Because there's people who, they're like, I'm still not sure. Typically, speaking again to you new grads, hopefully at this point you've already started applying, because you do not have to wait till you pass your NCLEX to start applying. And a lot of hospitals or wherever you're going, it's a couple months of an interview process, an application process. So get on it.
Yes.
Hopefully you've been prompted to already start. But if not, get on it.
Yes.
So,
and so a lot of the HR website portal, whatever applications, it'll ask you if you are a registered nurse. Say yes.
yes.
Because it's just a screening thing. It'll kick you out automatically if you put no. But yes, you're applying in that position as an RN because you will be in a matter of weeks. And they will understand that when they look at your
good point
portfolio or whatever resume.
Yeah. They'll understand that it's pending, certification.
You're not like perjuring yourself or anything. Just
good point.
It's
I can
okay.
see all these little honest people like, I don't know.
I know.
So typically back to the new grads going through school, you may have gone in knowing I'm going to be this. I want to be a CRNA. I want to be a nurse practitioner in blah, blah, blah. And maybe that's still the case. Maybe you completely changed while you were in school doing your clinicals, and you're like, oh my gosh, I actually really hated that, but I loved psych. Who knows? And maybe you're still kind of ambivalent. So, but that's okay. If you've got a venue or two that you think you're interested in, of course, that's a great place to start. If you're not sure, that's all right. We'll get there.
So things that you should be considering when you're thinking about where to go, because the hospital is not the only place to work.
Correct.
And honestly, working at a hospital is awesome. I mean, I've worked at a hospital pretty much my whole entire healthcare career. Just one short stint in a nursing home. Short. And
peace out.
But I think it'd be better if you started out somewhere else and then decide you didn't like it and then moved to the hospital, because you get paid more in the hospital. It's a lot harder to transition out of the hospital
into community.
Yeah, you get used to the money. So it's hard. So
good point.
Think about what hours you'd like to work. Yes. Do you want to work weekends? If you do, then great. Hospital life is for you. Yeah. If you don't, then maybe you need to go to the clinic or a school or somewhere like that.
Something totally different. I mean, are you okay? Like, I don't want to work weekends, but I don't mind taking my knocks and doing my turn and working my way. Okay. Then hospital, you can still consider. And like, if you are looking at hospital nursing, because a lot of the population in nursing does, what shifts are you wanting to do, and what is typical in your region for your hospitals? Here, I've only worked for hospitals that their standard is 12-hour shifts. There are very, very few 8-hour shifts. We do not have any 10-hour shifts in our system, unless, of course, you're just picking up something random, but even that's very rare. So are you good with that? Do you want a 12-hour shift? Do you want an 8-hour shift? Are you wanting to work 5 days a week? Do you like working 3 days a week? Look at what you want, and also, does that fit with what's available where you're applying? Because maybe those hospitals don't roll like that. There's a lot of hospitals that still do 8s.
Yeah, I've worked 8s, 10s, and 12s, and my favorite was 10s.
4 10s are nice. I had, not as a nurse, but a different medical position that I had before nursing, and it was kind of a good balance. Although, honestly, I felt like 10s rolled into 12s anyways, and then I was still working 4 days a week.
Yeah, that definitely can happen. But
I'd almost rather like a 6A to 6P 12-hour shift. We do 7 to 7s, and by then you're getting home and your kids are going to bed, so I almost feel like 6 to 6 would kind of be a little nicer.
Yeah, and some hospitals, they are much more flexible, and they might have like a 5 to 5 or a 3 to 3.
Yeah.
I worked 1 year as a circulator for C-sections, and I worked 5 to 1, 5 to 1:30, and I would stay a lot till 3 o'clock sometimes, just to relieve people for lunches, and that was the best shift.
That is great because you're home
So
well before like
nice.
kids are out of school. Thinking as a mom, 'cause
Yeah.
that's how I'm like logistically.
Yeah, it was great. So think about that because that's going to really guide kind of where you're going to go.
Right.
Another thing to consider is commute time and how you're going to get there if you're going to drive or if bus or carpool, and what it's going to cost you in time and money for the commute because it makes a difference. Sometimes taking a job that's lower paid but closer to home works out better in the long run.
Well, there's the monetary equation there, like you said, for time and gas and all wear and tear on your vehicle. If you're driving 30 miles plus, each way, that's that's an extra hour or more, because you're hitting morning traffic usually, or evening, one or the other. It adds time, it adds money. Is it really worth that stress? Because after a while, some people are great with it. Other people, it kind of tends to wear on them after a while. And again, are you a 3-day-a-week worker? Are you a full-timer? Are you a part-timer? You're like, I work 1 shift a week. I don't care. Great. That's awesome. But if you're maybe a Monday through Friday person who's working 5/8, I know I had quite a commute for a while. Anywhere from like 40 minutes at best to like over an hour and a half, depending on traffic or an accident on the freeway or weather. And when I worked 5 days a week, that was heinous. It was really, really torturous. But when
your days are 12, 13 hours with that commute. It's really rough on you.
But when I switched to a 3-day-a-week, when it went to 12s, that was huge. It totally different. I was like, oh, I could handle. For me personally, that worked much, much better. So yeah, definitely think of your commute and how that's going to impact you as well.
So one thing that I did regret as a new grad is when I went and I got a job, they said, hey, they offered me a part-time. And I was like, no, I need to work full-time.
Right.
And it's really hard because you're used to the money, and also those part-time shifts don't always come up. Mm-hmm. And I really wish that I had taken the part-time, and you could always work more.
Yeah, you can always, once you're off orientation, of course, not when you're in orientation, you can't pick up shifts almost, I'm pretty sure, anywhere.
No, absolutely not. But that would have been so much easier transitioning from
that work-life
school
balance.
and having children and having a newborn. I should have taken advice from people that knew things that had been there, but I was like, no, I need to work full time because I need money.
Right. And typically you're still once again, if we're talking 12s, if we're talking part-time, you're working 2 days a week instead of 3, for instance. Usually with that FTE, you're still benefits eligible. So if, there's people who are like, I need to have the benefits, I need the health insurance, I want the 401k or whatever. Most of the time you're still benefit eligible on almost every part-time FTE until you get to like a flex position, a per diem, or whatever your institution calls it. So don't let that, do your homework, I think is what we're saying. Don't let that sway you and scare you, because you can, once you're off orientation, you can almost always, especially if you're on a busy unit, you can almost always get extra shifts. And if not, it's a lot easier to increase your FTE typically with department heads than to cut it back.
Yeah. And I think the moral of that story is listen to people and be open, and don't think you know everything when you first start. Because that's what, it would have been so much nicer. I worked 36 hours, but it was 8-hour shifts, and it was night shifts. So I was working all the time.
Oh, that's just so yucky. I could
terrible.
Never do an 8-hour night schedule.
It was terrible.
Unless I still only worked 3, but then I want to get paid for 12s. That's my end goal. I want to work 8s, but get paid for 12s. So if anybody knows that job, get a hold of me at statsisters.com or Facebook. Maybe even from my home. That would be nice too.
That would be super sweet. That would be a super sweet nursing gig.
Yeah. Okay, moving on.
Okay.
What else do we want to look at? Where do you want to go? What are your end goals? Or maybe not even your end goals, but, where do you want to end up? Maybe you want to, you want to get your feet wet and start out in like a med surg unit or somewhere a little more general, but eventually I want to get into an ICU, or maybe you are going for that CNA position. And so you're going to have to eventually track into an ICU and get that experience before you can apply to a CRNA. Did I say CNA? CR.
I was wondering where you're going with that.
No offense. We love you, CNAs. No, you're wanting to go the CRNA route. So you think of those things when you're applying. You first of all know what your requirements are. What is your long-term goal? Are you wanting to go back for your master's? You already know that. Are you wanting to go back for an NP or some kind of advanced practice degree? And if so, what areas are going to be beneficial to you, or maybe even required for you to be working? And if not, even if you don't have those goals, like, what do you want? Where do you want to see yourself? Maybe not in 20 years, but even in like 5 years.
Yeah.
And think about that. What direction do you want to head? And are you okay starting out in one area and then transitioning? Or you're like, nope, I want to just commit and stay where I am forever.
Yes, that's legit too.
And some people do. And, bueno, kudos.
Yeah, we love those type of people.
Yeah.
So one thing that is super important to me, I find very important, is the culture and the values of the place that I work. Mm. And so I've always worked for nonprofit or not-for-profit hospitals because I just think that their mission is more aligned with my personal values. I've been a customer of for-profit hospitals, and I've had great service. There's nothing wrong with them. I think just when you work in them, the bottom line for-profit is profit, and the bottom line for non-for-profit is the patients, mm-hmm. and by extension the staff, because the community owns the hospital. So the community is the one, like, the hospital reinvests in the community and the staff, and it's just a different feeling. And so for me personally, that's what I looked for when I didn't have too many choices in the town that I was in. There was only 2 major hospitals, and sometimes you won't have that choice at all because there's one. But when you have the luxury of choosing, then that's something to consider. And then I also thought I wanted to be an OB, and so I really wanted to make sure that the practices that the hospital endorsed align with my values too.
Right, absolutely. And I think along with that line, what is the mission or the vision or whatever of the hospital you're working for? Is it also important to you things like magnet status and accreditations? Mm-hmm. Is that something that drives you? I know a lot of nurses, when they're making big moves and geographic moves, they're like, first thing I looked for the magnet designated hospitals, and immediately that narrowed down their field or where they were going to apply. And I've worked for both magnet and non-magnet hospitals. With the non-magnet, they were currently on the magnet track and they were working on it. And so I didn't see a huge difference, but that's, I'm sure, probably due to the fact that they were working towards that goal and, advocating for, nursing at the bedside, having the voice and, autonomy and all of that, nurse-driven, policies and, whatnot. But, some people that's going to be a big deal, and other people are going to be like, I don't really care. It's okay. And if I don't feel safe, then I'm just going to move to, if I don't like my nursing practice at that place, I'll just go somewhere else. But does it matter to you? And, something to look at. I was just going to say something else. Crap. Oh, I think also when we've alluded to this a couple times, quite frequently, but not actually just come out and said it, is you need to balance your personal life. I know you're stressing and you're thinking, but I have to work. I now have all these student loans to pay back. Mm-hmm. I have to work. I need to provide for my family or help provide for my family or whatever the situation is. I'm a single mom and I've got kids who I have to take care of. But don't just let that pressure push you into something. You need to get that work-life balance. You need to know what you need. Like Carrie said, you need to take a part-time position starting out and then see how that works for you and then slowly increase your FTE. Do you have, lots of little kids running around? Are you single? Do you have a support group? Are you new to an area and know nobody and you don't have childcare even figured out yet? Do you have, an ailing family member that you're taking care of? Think of your personal situations. And I know there's a lot of pressure right now that you're probably putting on yourself to just do it and be the job. But do yourself a favor because nobody wants burnout. And really, truly consider what is going to work for you. What shifts, maybe you want an 8-hour shift, but maybe being able to bang your shifts out in 3 days is going to be better for you, or vice versa. So try to find a balance between what's going to work for you and what's available and what you want versus what you need, I think. Because sometimes they're not the same thing.
Yes. Very good points. And my last little tidbit to think about is you just spent a couple years in nursing school and you did a lot of independent work and you did a lot of group work. And if you had a very strong preference to one of those methods of working, you should consider that. If you like to work as part of a team, then floor nursing might be great. That might be a good thing, or like an office. But if you really just don't like people that much,
and that's okay.
but you like patients, but you want to just kind of be independent, then there's school nursing, or like you maybe go to the PACU, or you're just kind of one-on-one, or there's other places where because we've talked about this a lot, how nursing is just so broad, you can find a place where you don't have to work so much as a team. Of course, there's always teamwork involved in nursing, but you can do more of your own thing, or you can work where you are working side by side with someone all the time. So just think about that too, and where you're thinking about going.
Yeah, that's a good consideration. So in case you're rapidly trying to take notes here. Hey, guess what? This is all on our website. There's a fantastic article written by yours truly, our little Carrie Sue, on our website that has all of our tips and a little more even than what we've covered to help maybe guide you to your new job, or you're changing fields, or whether you're new to nursing or just wanting to change your job. Maybe you've been in nursing and you just don't like what you're doing and you want to get somewhere else. But check it out. We've got a great article there for you to read and some tips to hopefully help you out and get you in a good, happy spot.
Thank you. Thanks for the promo.
You're welcome.
It's really great. I could have sold it, but I just decided that we were going to keep it for ourselves.
Oh, look at you.
So go read it because I didn't get any money for it.
That's very nice, Carrie.
I know.
Keeping it real.
Keeping it real. All right, so are we ready for Nurses in the News?
Yeah, let's do it.
Okay. So, Nurses in the News. There has been a nursing shortage. Have you heard?
Just once or twice.
Okay.
For like the last more than a decade.
So we always hear that there's a nursing shortage, and there is, but
True
there
that.
also isn't.
It's a little ambivalent. It's misleading.
Yes.
I'll say it's misleading.
Because it's actually kind of hard to get a job sometimes.
It can be. And yet there truly is a shortage.
There is. Like nationwide and worldwide there is. But then depending on the market you're in or the specialty you want, you may not have a job just waiting for you as you walk across the stage.
It's true. It's a little disheartening.
I know. This happened to Erin.
It totally did. So I graduated in 2008. Bad time.
Yes.
Economy tanked like a rock star. And so it literally went from the people who graduated one semester prior to me, where they were being flown out to location sites, wined and dined, put up in hotels, taken out to dinner, 2-day interviews with these hospitals for like a floor nursing job, paying off student loans. Or considerable chunks of them, $10,000, $20,000, no questions asked. Sign-on bonuses, really kind of treated like physicians are now. And then I graduated a semester later, and I felt like a theater major trying to get a job. And that is exactly what I told my mom. I was on the phone and I'm like, I don't understand. I'm like, I'm a nurse and I'm not an art major. I'm not a theater major. Why can't I find a job? And statewide, I applied literally in my entire state. Things were just shutting down. I wasn't living in Boise at that point because that's not where my school was, but I drove across the state to interview for a position here. And I got into town, I don't know, 3-4 hours before my interview. And I got a phone call from the hospital, from the HR, like within an hour of me getting into town. And I thought, oh, that's kind of odd. And so I answered the phone and they're like, oh, hi, just calling to talk to you about your interview this afternoon. Are you already in Boise? Because I knew I was traveling. And I said, well, yeah, of course I am. And they said, well, we're going to have to cancel it. Their word came down from like uppity up hospital administration this morning that we were going on a hospital system-wide hiring freeze as of immediately. Canceling all applications. People who had just been offered a job last week were good. I had a student, what in the heck do we call those people? Nursing school buddy. We're going to go with that. Who had just gotten a job offer like 1 to 2 weeks before me. Same hospital, same unit. And yet mine was canceled. And everywhere across the state, that's how it went down. So I was forced to go into a field that I wouldn't have considered. I actually took a director of nursing position at an assisted living memory care unit, which I felt I was way over my head for a couple years afterwards until I could get back into the hospital system, because despite the shortage that was there, they were short nurses financially. They couldn't afford to hire new nurses, and it's really expensive to train new nurses. Plus, with the economy crashing, the nurses who were presently in-house, who had maybe been per diem, who had maybe been part-time, their spouses were getting laid off. They were losing their jobs. So they had to pick up hours and FTEs. And so there wasn't actually as much of a need because people were doing a lot of forced overtime on their own to fill, holes at home financially. So it was really weird. It was because it was very fast. And I was just like, I'm never even going to get a job. And I started to feel a little desperate because it took a few months. And I accepted a position that I was really not excited about, but I'm like, I have to feed my family. I have to do something. My husband was still in college at that point. And then fortunately something better came along like a week or two later. But I was nervous, and it was the weirdest position to be in because I heard all about this nursing shortage for like years and years beforehand. And yet it was there, but it wasn't.
Right. Well, it was there because being a new grad and being a director of nursing, even for a memory care unit, that terrifies me.
Oh yeah, I was
when you told me that's what you were doing, I was like,
what?
Yay!
I was doing the same thing.
I was like, well, that's great. I was like, oh my gosh,
just keep swimming. I did not know what I was doing for a good year. I kept reading my regs. Please don't let it get shut down.
Oh my gosh.
Take care of your patients, no matter where you are.
But the good news is, that was a nationwide recession, but there are pockets like Houston just went through this last year where there was hiring freezes. Yeah. Even though we are short nurses there too. So, there's going to be pockets of this.
Yeah, it lasted, I think, external hires were frozen, I want to say for a year and a half here. And they would do transfers in interdepartment, but then they finally started opening it back up. But it was like a trickle. A little bit here, a little bit there. And of course, then the floors were so deficit at that point, and then there's the concern where you get a new onslaught of new grads and who aren't trained, and how do we balance safety? And anyway, so yeah, it's definitely it is. There is a shortage.
There is, but there's good news. According to this article, which we will post the link, 2016 and 2017 may be the best time to start a career as a registered nurse.
Whoop, whoop, that's you.
Because, I know. So congrats. Yay.
Things are looking up.
Things are looking better. The baby boomers, I'm sure you've heard about them.
Yes, I think you might have known who they are.
They are retiring in droves, and they're getting geriatric.
So number one, their jobs are opening up, and number two, they're becoming patients more and more.
So that's a little morbid, but hey, that's the way
it
is.
Realistic. It's just the population,
Yep. So we need geriatric population is a huge need.
Absolutely.
Huge need. And for nurse practitioners as well.
Mm-hmm.
And healthcare organizations are getting better at staffing levels. And so they're hiring more nurses.
Yes.
And they're hiring not just floor nurses, but like support level nurses. Like maybe there's a discharge nurse or, increased charge nurses. There's just lots of different positions.
Yeah, relief charges, triage nurses, task nurses, resource nurses. There's all sorts of different codes for them, or even float pool. We didn't even talk about that, but float pool, CSU, clinical support, however it's verbiaged in your region. That is a fantastic position for people who are those like eeny, meeny, miny, mo, I'm not sure where I want to go type nurses at this point, because you get so much exposure, and a lot of times you get a sweet hookup. If you find a unit you like, they're like, we love you, come to us. So that's a great one as well. And there's an increase, I think, in those to support other units. So yeah, staffing just in general, I feel we're finally getting a better patient ratio. Not everywhere, I'm sure, and there's definitely units that are better than others. But I think we're starting to improve.
We are. And then if you're still having a hard time finding a job, do you have an associate's degree in nursing? If you do, then you need to get your BSN, because a lot of opportunities are going to open up to you, and a lot of hospitals are moving away from hiring new graduate ADNs at all.
Not a lot, almost 50%. Like, what is this? 43.7. That's almost half people.
Yeah, and that's just going to keep growing as more people. I mean, the statistics say if you're a new grad that has a bachelor's level, you're going to have better patient outcomes. And so they're looking at that, and they want to have the best patient outcomes, and so they're going to hire a BSN level.
And even if you're concurrently enrolled, when you're applying, like, yes, I'm an ADN, but I'm enrolled in a BSN program, that is huge in your favor.
Yes.
So don't let that deter you. I know people who are like, oh, I just have to wait. I can't switch. I don't like my job. I hate my job. I want to switch, but I'm not baccalaureate. Oh my gosh.
Prepared.
Thank you. I'm not baccalaureate prepared at this point. No, most of the time. And check into it. All you have to do is a simple phone call to the HR department, and they're not writing your name down and putting it on a dartboard. Just, it's a simple phone call. They're going to forget about you as soon as they hang up, to find out, like, hey, I have an associate's degree. If I'm enrolled in a baccalaureate program, can I still apply for jobs at, positions at your establishment, or do you require that I've completed it? Most of them, I know here locally, as long as you're enrolled, it's almost as good, because they know that's what you're doing. They know you're forward thinking. They know you're progressing your education and working on it. So most of them, I would think, are good with that. But look into it. Don't assume you have to wait that extra year, or I can't do it yet. Check it out. Be educated about your education, about your level of education.
Yes. So that's nurses in the news.
Yeah,
we need more nurses.
We do.
And the jobs are getting easier to find, apparently.
They're loosening up. And I've seen that definitely firsthand when I eventually switched into the hospital nursing field versus now. Before it was like, okay, we're opening them up in the hospital, but you're going to a main floor. You're going to a med surge for at least a year. Back kind of how it used to be. Before it was like, tempt you straight into these specialized positions and schmooze you into them. That's not what happened. We'll start hiring some new grads here or there. And now in the med-surg type units or the nursing homes or the SNF, LTACs or whatever. But now I'm seeing new grads come straight to specialized fields again. Pediatrics, ICU, emergency, OB, not just like postpartum, but actually down to the L&D where you're at that critical care setting, and NICU, not a ton typically, but there's those spots are now open for direct hires, because yes, it's great to have that base level of experience. And I really think I learned so much, and I'm grateful for it that I did go the med surg route. It wasn't my initial plan, but I was okay with that. I understand that it had to happen, so I was good with it. And I've learned so much. But so there's something to say for that track. But there's some units who want to just take this brand new grad and just, mold them into their little precious. And if for somebody who's like, I love OB, that's all I want to do. I love peds, that's all I want to do. And I know those nurses, they've been a pediatric nurse since they graduated 24 years ago.
Yep.
And they've never, ever wanted to do anything else. That's awesome.
Yep.
That's great. Who cares if you don't know how to do adult stuff? That's fine.
Yep. I agree.
Anyway,
well, that's all for today.
Yeah, that was good. You guys, so nutshell version. You've got this. NCLEX, you own it. It's your thing. Do it. And just chill. You're going to be fine.
Yes.
The world will be okay. Life will continue. You will get a job. You're not going to be homeless living under the bridge. You're going to be okay.
That's right. Absolutely.
So, all right. Well, reach out to us at statsisters.com or on our Facebook page. You can like us and comment. Where else are we, Carrie?
statsisters@gmail.com and Twitter.
YouTube, Twitter,
Instagram.
SoundCloud.
Everywhere podcasts are heard.
Boom, boom, boom.
All right. And we've got a lot of SoundCloud interaction today. I was looking at it. Nice. Lots of people liking and commenting, and I appreciate it. I like it.
It's fun. We love that. And then I think we're really good about responding quickly. At least I hope we are.
Well, according to Facebook, we have 100% response rate in under 7 minutes.
Ooh, wow.
So we are super responsive.
It kind of makes us look like we're dorks. It doesn't have a life.
Well, no, there's two of us.
We're really dedicated. That's what it is.
So comment, like, share, tell your friends. Tell your friends. Oh, and you can always go to Patreon.
Oh, yes.
We're still waiting for our first sponsor, so help
it
us
might
out.
be you.
Yeah. All right. Thank you, everyone. Bye.
All right, have a good one. Good luck, guys.